This video was originally designed to be used in our clinic during an office visit. You may simply watch the video for general education, or if you plan to use this in preparation for an upcoming wellness exam, you may print out the handouts and checklists mentioned in the presentation. These are found in the patient education section on the website homepage. Please note, this video contains pictures of adult sexual anatomy used to explain cancer prevention health services. This may be too sensitive for younger children, and parental or caregiver discretion is advised. This video was produced on behalf of your healthcare providers at the Center for Family and Preventive Medicine, Dr. Henderson, Dr. Roach, and nurse practitioner Patricia Henderson. Among the most valuable healthcare benefits available to you are those that prevent or lessen the harm of serious disease. One of our important roles as your healthcare providers is to help you understand and take full advantage of these benefits. Thanks to advances in medical science, a number of serious and potentially life-threatening diseases can be prevented or at least diagnosed at an early stage. This can make the difference between a long and healthy life and the life that is needlessly shortened or burdened with disability. A simple test or procedure can often prevent a lengthy and costly hospitalization. In the case of cancer, preventive services may eliminate or reduce the need for chemotherapy, radiation, or surgery. An added benefit is to lessen the financial burden you may have with a serious illness. As your primary healthcare providers, we strongly recommend that you take advantage of the best healthcare available today by putting preventive medicine at the top of your healthcare priorities. The remainder of this video will present information on the major preventive services that we encourage you to consider. These are tailored to your age and gender. This information will be updated at least annually to ensure it is correct for your age and based on the best scientific information available. Therefore, we shall ask you to review this periodically in conjunction with one of your office visits. The topics covered today will be screening for colon and breast cancer and cervical cancer. Adult immunizations will include the influenza or flu vaccine and the pneumococcal or pneumonia vaccine. We'll also cover screening for depression, osteoporosis, tobacco use, and touch on the important subject of advance directives. Your medical assistant will provide you with a handout that will give you important information on preventive matters not covered in this video. This includes immunizations not provided in this clinic, injury prevention, nutrition and exercise, substance abuse, safe sex, dental health, skin health, and CPR training. The bottom line for colon cancer screening is that early detection equals increased survival. The colon is a large structure in the lower abdomen and is a common site of cancer in women over 50. The key to survival with colon cancer is early detection. When the cancer is discovered early and localized to the colon, the 5-year survival is 90%. If the cancer is allowed time to spread, the survival may drop to 10%. This shows the stages of cancer. The red arrow at the top left points to a picture of cancer at an early or localized stage when the survival rate is very high. This is the same picture, and the red arrow at the right bottom points to a picture of colon cancer at advanced stages when the outcome is very poor. So what are the best methods to detect colon cancer at an early stage? The most thorough method is to have a specialist insert a scope into the colon. There is a long scope used to do a colonoscopy and a shorter scope used to perform a sigmoidoscopy. They both can detect cancer and can detect precancerous polyps that can be removed before turning into cancer. The main concern with this exam is that there is a small risk of injury to the colon during the exam, which can be serious. You must be willing to accept this risk to get the benefits of the most thorough method of screening. Another method is an X-ray known as a barium enema. Barium is inserted into the colon and allows a radiologist to look for signs of cancer or polyps. If problems are found, the scoping procedure is then done for biopsy or polyp removal. The third major method for colon cancer screening is stool cards. Colon cancers often leak blood into the intestine, and this can be detected in stool specimens that are collected and applied to a card. The exam using the long scope is performed every 10 years if no problems are detected. The shorter scope exam is done every 5 years. The barium enema is also repeated every 5 years. Stool card testing should be done every year. We also recommend doing a stool card test on the years in between having a scope test as added insurance. Future possibilities for colon cancer screening include advanced imaging, such as virtual colonoscopy and DNA testing, but these are not in common use at this time. Breast cancer is the leading cause of cancer death in non-smoking women. The good news is that early detection can produce a 5-year survival of 98%. As with colon cancer, if the tumor has spread widely, the survival drops dramatically to 26%. These are pictures of a PET scan showing cancer that has spread widely beyond the breast, and the outcome for this individual is poor. So what is the best method for you to detect breast cancer at an early stage when the survival probability is very high? The answer is mammogram. This simple test can detect breast cancer as long as 2 years before it can be felt as a lump. It should be performed every year. Since mammogram cannot detect a small number of cancers, you should also have your breast examined annually by your healthcare provider. The cervix is the lower part of the female uterus. The red arrow at the bottom left points to a picture of a normal cervix. The black arrow at the top right indicates a graphic of a cervical cancer. From left to right, this shows cervical cancer advancing from early to late stage. Cervical cancer can be prevented or at least detected early and treated successfully in almost all cases with regular pap smears. A major contributing cause for cervical cancer is the human papillomavirus, or the HPV infection. There is a vaccine for HPV that can prevent cervical cancer. It is given in a series of 3 doses and is currently recommended for women under 27 years of age. Pap smear recommendations for women with a uterus are: obtain a pap smear every 1 to 3 years if you are at standard or average risk. Your pap should be done every year if you are at high risk. This would include high-risk HPV infections, abnormal pap smears, or multiple partners. Pap smear recommendations for women without a uterus are: if there was no cancer with your hysterectomy, you may stop getting pap smears after 3 normal pap smears. If there was cancer with your hysterectomy, you should continue to get pap smears every year. If you do stop getting pap smears, it remains important to get regular well woman exams to check your breast and ovaries and other well woman issues.